In this video, we're going to summarize and highlight the latest information from the 2025 American Heart Association Emergency Cardiovascular Care Guidelines as they relate to healthcare provider CPR. Just like in previous updates, the goal of these guideline changes is simple. It's to improve the survival of our patients by improving early recognition, high-quality CPR, and early defibrillation. Despite decades of public education, bystander CPR, and AED use, they still remain inconsistent, and the outcomes for out-of-hospital cardiac arrest still depend heavily on what happens in the first few minutes. The 2025 ECC updates continue to emphasize that early action by healthcare providers is what truly saves lives. Many of the changes you'll see focus on improving CPR quality, reducing delays, and removing barriers that prevent people from stepping in to help. Now let's begin with initiation of resuscitation for adults. The ECC continues to reinforce the importance of CPR with breaths in adult cardiac arrest. If a rescuer is not trained or doesn't have the ability to safely give breaths, then hands-only CPR can be used, as providing compressions alone is still better than doing nothing at all. Now, whenever feasible and without delaying chest compressions, CPR should be performed where the person is found, as long as high-quality CPR can be delivered safely and effectively. It's preferred that the patient be in the supine position, which means on their back, on a firm surface, since firm surfaces improve compression depth and effectiveness. Delays caused by unnecessary movement of the patient are associated with worse outcomes. When possible, chest compression should be performed with the patient's torso positioned approximately at the level of the rescuer's knees, as this positioning has been shown to improve compression depth. Rescuers may also consider placing their dominant hand on the sternum when performing compressions, which may further improve overall CPR quality. So the key takeaway is this: don't delay chest compressions. If high-quality CPR can be delivered safely where the patient's found, then begin it immediately. When providing ventilations with a bag mask device during adult cardiac arrest, it's reasonable for one rescuer to use two hands to open the airway and seal the mask, while a second rescuer squeezes the bag to improve ventilation effectiveness. The 2025 guidelines re-emphasized a really important barrier to public access defibrillation, particularly for women. See, evidence suggests that the need to expose the chest may actually contribute to lower rates of AED use in females. Now, while proper pad placement is always preferred, current evidence shows that successful defibrillation can still occur even when pad placement is not exactly perfect. Now, because of this, it is reasonable to apply AED pads directly to the skin by simply adjusting clothing or undergarments rather than removing them entirely when it's appropriate. The priority remains rapid pad placement and early defibrillation while maintaining patient dignity and reducing hesitation that can delay care. In adult cardiac arrest, the use of a mechanical CPR device should only be considered in specific settings where delivering that high-quality manual compression may be challenging or dangerous for the healthcare professional. When mechanical CPR is used, rescuers must strictly limit interruptions in chest compressions during deployment and removal of the device. High-quality manual CPR should never be delayed while preparing or positioning a mechanical device. Now, for conscious adults and children with severe foreign body airway obstruction, rescuers should perform repeated cycles of 5 back blows followed by 5 abdominal thrusts until the object is expelled or the person becomes unresponsive. This sequence reflects evidence suggesting that back blows may be more effective and cause fewer injuries than abdominal thrusts alone. In special circumstances, such as late-stage pregnancy or when abdominal thrusts are impractical, chest thrusts should be used instead. For infants, abdominal thrusts are still not recommended. Instead, back blows and chest thrusts will continue to be used. See, a key update in 2025 is that chest thrusts for infants should now be performed using the heel of one hand, placed in the center of the chest rather than the previously recommended 2-finger technique. This change is based on evidence showing improved compression depth and effectiveness during severe airway obstruction. For adults and children in cardiac arrest following drowning, CPR with breath should be started before AED application. Drowning-related cardiac arrest is typically hypoxic in nature, meaning oxygen deprivation is the primary issue. Early ventilations are critical, and applying an AED first may delay the initiation of effective CPR with breaths, especially since shockable rhythms are less common in these drowning cases. The 2025 guidelines introduce a single standardized chain of survival that now applies to infants, children, and adults. It excludes neonates as they still have a separate chain of survival. This unified approach emphasizes early recognition, early CPR, early defibrillation, and advanced care, as well as recovery as a continuous process across all age groups. In infants and children, studies consistently show that CPR with both compressions and breaths provide the best chance of survival. However, if providers are unable to provide breaths to an infant or child in cardiac arrest for safety concerns, then compression-only CPR is reasonable. Large observational studies show that compression-only CPR is far better than providing no CPR at all, and significantly improves survival outcomes compared to no bystander intervention. In unresponsive adults and children with durable left ventricle assist devices, otherwise known as LVAD, chest compression should be performed when there are signs of impaired perfusion. See, an LVAD device is a mechanical pump that is surgically implanted to help the heart's main pumping chamber, the left ventricle, to circulate blood to the body, used for end-stage heart failure. The presence of an LVAD does not eliminate the need for CPR during cardiac arrest. The 2025 ECC CPR guideline updates continue to reinforce a simple but powerful message. Early recognition, early CPR, and early defibrillation saves lives. These updates are designed to improve CPR quality, reduce delays, and remove the barriers that prevent rescuers from acting, whether that rescuer is a parent, a bystander, or a trained professional. Guidelines are going to continue to evolve as science advances, but the mission remains the same. Recognize that emergency, take action, and do the best you can. CPR doesn't need to be perfect to save a life, and doing something is always better than doing nothing. Confident, informed rescuers make the difference. Thank you for taking the time to review these important updates and for your continued commitment to life-saving care.